Hello, my name is Serena Chen. I'm a physician at the Institute for Reproductive Medicine and Science in New Jersey and the director of the Division of Reproductive Endocrinology at the St. Barnabas Medical Center in Livingston, New Jersey. I'm really honored to be here today to talk to you about advocacy as a healthcare provider. And I've worked with PCOS Challenge and the PCOS community for a few years now, and it's been a wonderful experience. And I wanted to talk with you about that today because advocacy is not only something that you do for others, but I also see advocacy as a way to infuse more purpose and meaning into your life as a healthcare provider. In fact, in these days of enormous healthcare provider burnout, I find that advocacy can be one solution, one treatment for burnout. And because when we talk about provider burnout, we are finding that the pandemic, and even before the pandemic, the drudgery of the ins and outs of daily tasks that every healthcare provider has to deal with, massive amounts of documentation, the electronic medical record, regulatory, dealing with insurance companies, leads to burnout because you have we sometimes lose our way in the drudgery of all those things we have to do day to day. I think we all decided to do healthcare because we wanted to help people. We wanted to make a difference. We wanted to heal and relieve suffering, and we see that in our interactions with patients when we can really make a difference. And yet our healthcare system doesn't always allow for that. We often find ourselves not really spending time with patients, and often having our just spending a ton of time with charts and electronic medical records, long hours, and dealing with a lot of rules that often are obstacles in our ability to take care of patients. Often we know what the right thing is to do for the patient, and yet the insurance company or the rules or whatever don't allow us to do what's right for the patient. And that all those things can lead to healthcare provider burnout. And I've experienced all those things. And have found a lot of renewal of purpose and meaning and autonomy as a physician doing advocacy. Advocacy has allowed me to use the expertise that I have as a healthcare provider in different ways, rather than just being inside the system, treating patients in the clinic every day and wrestling with insurance companies and rules and all the logistics of our healthcare, of our very complex and difficult healthcare system. It's allowed me to use my experience and knowledge and step outside that individual patient provider relationship and make connections with other people, other advocates, other experts, patients, and legislators, and other people in the healthcare space to try to drive change in different ways. And advocacy can allow you to impact many, many lives at once, as opposed to just one person at a time. So a lot of healthcare providers, look at you funny when you say advocacy is a great thing, because they're like, I went to medical school, like I went to nursing school, like I know how to be a doctor, I know how to be a nurse. What has this got to do with me? I'm not into politics. I'm not into any of these kinds of things. I'm uncomfortable. I will tell you, as a physician, I think a lot of physicians feel this way. We like to be the smartest people in the room. And the way we do that is we went to school for many years. We went to many years of training. We worked really hard in order to get to this position we're in now. And that gives us a sense of control. That, I'm board certified in OBGYN and reproductive medicine. So, like, I know what I'm talking about. But those same tools, that same training, that same experience actually makes you an outstanding advocate, because you have the training and the experience and the knowledge, and you've been in the trenches with your patients, and you know what the struggles are, what they are suffering, and what you're suffering. What are the obstacles that prevent you from really treating your patients? We don't have funding for polycystic ovarian syndrome. Everybody in women's health is frustrated by the lack of data in general for women's health. And PCOS affects millions of people. We see it every single day. And yet there are so many more questions than answers. And obviously there's a lot less funding for PCOS than there is for, say, male-dominated diseases like cardiac disease or prostate cancer or things like that. Not that those aren't important, but clearly women's diseases, PCOS included, has kind of gotten the short end of the stick when it comes to funding. And you can talk from personal experience about how that impacts your job and how it impacts the lives of your patients and how serious this disease is. So you already have the tools to be an outstanding advocate. Just the way you talk with your patients, to explain to them what PCOS is and how it affects their lives. You can explain that to a congressman or a congresswoman or a healthcare staffer in Congress and really connect with them and help them to understand why their support is so important. Or, you can just write a check to PCOS Challenge and help PCOS Challenge really advocate with the legislators. There's so many different ways you can contribute, but I will tell you, it's been a phenomenal experience to go to Capitol Hill, either in person or now virtually, and talk with the legislators. They really do want to hear from you. It's not really self-serving, although as a healthcare provider, you get the return on investment for yourself as an individual is so great. You do feel like, you're making a difference, connecting with people and educating them about something you deal with every day is a great experience. And you really should just, talk to these staffers and the congressional people, just like you would talk with their patients. They want to know what PCOS is all about. They want to know why is it important and how it really does cost a lot of dollars in morbidity and mortality, and how legislation could make a big difference in their constituents' lives. Remember, you are also a constituent. So you're not just a healthcare provider, you are also a constituent. And the return is great. First of all, it's just a great experience to, connect with all different aspects of advocacy, all the people. It's like an amazing community. It's fun. You meet people from all over the country, and people who are interested in advocacy for many different reasons. But it's also a big thing to your patients when your patients know that you're advocating at that level outside of the practice. It really is inspiring for them. It means a lot to them. It's great marketing for your practice. The other thing is it's really also inspiring to the other people in your practice. So for myself, a lot of my employees have become advocates, and that has made them better employees and really help them to improve the patient experience, which is then comes back as great marketing and we get more patients. It's like just a really positive circle. And feeling that you can take back a little bit of control, a little bit of autonomy, purpose, and meaning as a physician, as a healthcare provider, really does really does positive things for burnout, because a huge part of physician burnout is not just the long hours and the hard work, because I mean, we went to medical school, that's what we signed up for, long hours and hard work. That's not where the burnout completely comes from. Like, yes, we do have to have some vacations and some break and some self-care, but like doing yoga and meditating is not going to completely solve the issue. We know a huge part of the issue of burnout is the broken healthcare system. And if you feel like you can make a difference in that, and you're really making a change in that, I think that sense of purpose and meaning and autonomy goes a long way to helping with burnout. So anyway, that's my personal perspective on advocacy and healthcare provider burnout. I'm so happy to see you joining PCOS Advocacy Day. We're really excited to have you. Please connect with me. You can online. I'm at Dr. Serena H. Chen, Dr. Serena Serena, like Serena Williams, only I don't play tennis. H for high maintenance, and Chen, Chen, Dr. Serena H. Chen on Instagram and Twitter mostly, LinkedIn as well, Facebook as well. I would love to hear from you, love to hear about your advocacy experience. Have a great time. Take care.